Thanks for joining us tonight. Right now, there are just under 10,000 confirmed cases of monkeypox reported across 63 countries. The CDC says 750 of those cases are in our country. And today, state health officials confirm Minnesota has 10 confirmed cases. The type of monkeypox spreading right now is not as infectious or transmissible as a more deadly type that is native to Central Africa, but it's still considered a special pathogen of concern by our federal government, and that puts it on the radar of a unique medical team at M Health Fairview. And today, Kent got rare access into the special pathogen unit inside the U of M Medical Center in Minneapolis, where they're getting ready for monkeypox and just about anything else that could come this way.
Yeah, that's right, Jana. The team I followed today has to be ready for just about anything because they are our region's first line of defense for the most infectious and severe viruses that might come our way.
To understand what a special pathogens unit does,
all right, so we'll go through our checklist.
It's best to start at the beginning and watch this highly trained team of doctors and medical staff with M Health Fairview don layer after layer after layer of personal protective equipment, followed by a couple more layers, just to take part in a readiness drill that happens in only 10 locations across the country.
We're the regional treatment center for this region, which is the Great Lakes region, which serves 6 states.
Dr. Susan Klein is the medical director on this federally designated unit.
What makes a special pathogens unit different physically, just in terms of the layout?
For one thing, we have this laboratory right here, which is set up to do point of care testing right up on the unit. So if we had a patient admitted with Ebola virus disease, for instance, you could run tests up here.
The unit also consists of 2 high-level isolation ICU rooms, and in this drill, the team is wearing the highest level of PPE because it is simulating a response to an Ebola patient, while testing the doctor's ability to put a central line into a simulated chest.
Those are venous catheters that feed into the central vein and provide IV access for critically ill patients.
And even though it's a routine procedure, nothing about this is ordinary.
It's a good experience to practice it. I mean, it's a lot more difficult than our usual procedures with all the isolation gear.
These regional centers were formed in response to the Ebola outbreak in 2014. But in recent years, these drills have informed care in important ways.
The skills that we practice as far as our training on this special pathogens unit helped us respond quickly to the COVID outbreak.
Move it around and make sure it's not going to fall off.
The team helped with PPE and other training as M Health Fairview opened its first COVID unit inside Bethesda Hospital. And while new variants keep emerging, the team is also watching the monkeypox outbreak.
In the case of monkeypox, if you had a patient during the current outbreak who did become seriously ill, required an ICU admission, for instance, this would be a safe place to care for them. They could have an infection that was affecting their lungs, for instance, because monkeypox can potentially be spread through the droplet or airborne route.
Does this take on greater urgency in a time when we're seeing some of these things spread?
Well, I think it makes it real, for all of us, realizing that one of these patients might show up at our facility or a referring facility, and so we really have to be prepared and ready to respond.
As you might imagine, today's training was one of many held throughout the year. The team practices a variety of skills tailored to different special pathogens that all come with different considerations for care and safety. Jana.
Really interesting and important look inside. Thanks so much, Kent.